Hello, everyone. My name is Joseph Galvin, and I'm the HUD Midwest Regional Administrator, representing the states of Illinois, Indiana, Ohio, Michigan, and Wisconsin. This is the inaugural program of Midwest Matters, and we have a really great guest, Neli Vazquez Rowland, who's the founder, president, and CEO of a Safe Haven Foundation. She has a great story to tell about the work she's doing. It's a pleasure, and thank you for joining us this afternoon. There are a few things I really want to talk to you about, but first, for the people who are listening, if you can talk a little about the Safe Haven Foundation, why you started it, what your mission is, and some of the things that you are accomplishing.
We've been on the front lines of helping address the issue of homelessness and poverty throughout the Chicagoland area since 1994. And our backgrounds really were not in social services. We are not psychologists or psychiatrists. My husband and I both come from very similar backgrounds. You know, I'm first generation American, so is he. And, you know, our families worked very hard to, you know, give us, you know, the type of lives that we have, access to opportunities, and, you know, and education and things like that. It wasn't easy. And like most people that come from poverty-stricken communities, we had a lot of setbacks in our own lives, which informed, you know, our compassion for people that have issues such as substance abuse and such as poverty issues. And fortunately, we had, you know, people throughout our lives that saw potential in us, and we had these parallel paths, right? So we met in college and both went into the careers of finance. And I was in the field of finance for 13 years, and so was he. And when we wanted to start giving back and making a difference, it was really important to us to start thinking about, you know, the people that got left behind in the communities where we came from, that suffered from underlying issues that our family suffered with, and didn't have the access to the opportunities to get access to treatment, for example, or education or job training. So thankfully, you know, ASAFE, my husband and I, you know, had these experiences in our own lives, and we ended up having, you know, an opportunity to invest in real estate. It was in 1994, and we wanted to start diversifying our portfolio and in real estate to begin with, but then at the same time, we were looking at, you know, what we were going to do to give back and what was going to be the cause that we were going to choose. And we decided that, you know, after doing tremendous amount of research and looking at different types of causes, we realized that the way the system was set up to address substance abuse issues and poverty-related issues were really well intended when they were set up originally. But what was missing was the ability to really connect the dots with all the right kinds of wraparound services that people need, that we're going to actually work towards solving these underlying issues such as unemployment, addiction issues, criminal justice, you know, reentry issues and things like that. And if you recall, at the same time in 1994, we were actually strengthening the laws against people that were, dealing with substance abuse issues. And we were really criminalizing these problems. And again, just being a personal issue to us, we realized that we had escaped, that slippery slope, and it would, the future generations of people that were suffering from these issues were not going to be so lucky. Another thing that was happening at the time was HMOs were going public in the 90s, and being in the markets, I also realized that the first thing they did to cut costs was cut, treatment programs. So you may recall that it was customary for health insurance companies to cover the cost of 28-day stays. What they did is they ended up reducing those benefits to just cover the cost of a simple detox. So fast forward, we're buying these buildings and we realize, what are we going to do with these properties? We can turn around and turn them into apartments we could rent to people, but these communities had not yet gentrified. They were very distressed.
And taking those gifts that you have, the financial piece that you have, and your personal story, and just putting it all together to be able to serve our community. There's a passion there, there's gifts there, and it's something that is on fire quickly. You're very passionate, and people recognize that. And I think that's one of the reasons why you've been so successful, because people love to jump on teams that are successful. And if their leaders are passionate, even more so. Well, before we get into COVID-19, one of the things I want to ask is a little about the EnVision Centers. When the secretary first came on board, one of the things he wanted to do was this secretarial initiative called EnVision Centers. And the EnVision Centers are based on 4 pillars of economic empowerment, character and leadership, health and wellness, and educational advancement. And we talk about these 4 pillars because the 4 pillars of any structure will hold up a roof, and you are able to build upon it. So when we rolled out demonstration EnVision Centers, you applied and you were awarded, designated one of the first EnVision Centers in the country. Can you tell me why and what has that done for your organization?
I think the EnVision Center concept is really the missing link. I think that while many administrations have talked about breaking down the silos, they've never had a mechanism to actually accomplish that goal. And I believe that the framework of the EnVision Center really does acknowledge the need to integrate all of the types of pillars that you need to have in your life and to really succeed, as the director mentioned, that's what holds up the roof, right? If you've got all 4 pillars on a solid foundation, that is what is going to weather any kind of economic storm, health storm, you name it. So I believe that, the 4 pillars are absolutely right on with what is needed. And by being able to connect the 22 federal agencies to really streamline their thinking in terms of how they can each play a role towards supporting the EnVision Centers, I think that's truly a mechanism. And I talk about it all the time, to people in terms of, how this is the concept, and the language, the goals. Having the secretary come out and see for himself, the work that's being done at A Safe Haven. I think, he also, agreed, that what we've done is really a testament to, the fact that the EnVision Center isn't just a good idea. It actually works in practice because it's exactly what we do.
When the secretary and I visited your facility, he was just totally blown away at the size, the holistic approach, and all the good work you're doing. So this kind of dovetails into the other question. EnVision Centers are taught about community and working together. And while we have this pandemic going on, COVID-19, in the city of Chicago, it still hasn't increased, I don't believe, in terms of the number of patients. But you saw the need and the community spirit to approach the city. And you offered to help and work with Rush and Heartland Alliance, Rush University Hospital Systems and Heartland Alliance, to offer a 100-bed isolation ward. That's extremely impressive. And can you tell us a little bit about what you're doing, where it's at, and some of the challenges?
Yeah, that was, I mean, it's going to make an interesting case study because it was absolutely a very high stakes game right, to get into. And, there was a lot to consider. When we started the conversation, and actually it was around, March 5th, 6th, I started having the conversation with Rush about this idea. They were starting to model out, the number of potential cases that we might have in Chicago. And we knew that the homeless were the most likely to capture the disease and contract it. They had all the high risk factors associated with people that would have a high predisposition to getting the disease. Again, the homeless getting the disease would be horrific for any city because of the fact that they would literally be the super spreaders. If you cannot contain the COVID-19 virus among the homeless population, I mean, we will literally see it spreading all over the city, because even though we had this shelter in place, order in place, we definitely know that we have now homeless that will be resorting to riding buses and being in public spaces, if they had nowhere to shelter. So it was definitely a lot to consider in terms of, what we were going to do to respond to this, because, we too were concerned about our general population. And what's really, again, I started to describe a little bit about A Safe Haven's model, which really saved us. And that is the fact the way we're set up is we have semi-private accommodations for people. We don't have people laid out in cots. We've always believed you've got to give people their dignity, you've got to get them their space, and you've got to have them in a setting that really is respectful, and gives them the privacy that they need, and a mother with children, the privacy that she needs to be in a suite with her children, and have the ability to close the door, if she needs that privacy. So just the way we were set up, just by definition, and A Safe Haven, we've, always been extremely overly cautious about not just the pandemic, but any communicable diseases. We know about tuberculosis, we know about hepatitis, so we've always designed all of our infection control policies. From the moment somebody walks in the door, they go through a bed bug protocol. They got to shower, they got to, everything's got to be cleaned, and if you've ever been to A Safe Haven, I think you can agree that, it's probably the cleanest place. My house isn't as clean as my office is, unfortunately, but it is something that, we're just very, very conscientious about. And we teach people in the program about, cleanliness and about hygiene as part of everyday living. So because it was flu season, we had very, very dedicated systems in place just for flu, so we had anti-sanitizers, and things like that, in place. So obviously, as we started to in fact, I personally started paying attention to this in late January, early February. I was invited to be a speaker, a keynote speaker at a Chinese New Year event. And I never, ever cancel a speaking engagement. And it broke my heart to have to do that to them. But it was the beginning of February. And, I knew that the position I was in, could not expose myself to that. So anyway, they understood, but just to let you know how heightened our awareness was and our alertness was to the situation, we started taking all the precautions and measures. And on March 15th, we pulled together our incident command center at A Safe Haven and pulled in all of our directors and immediately started to put together our response. And it was, I believe, March 21st when the governor announced the stay-at-home order, the March 20th. By that time, we had already had many, many things in place. And then on April 14th, 3 weeks after we started talking about this, we actually closed on our contract with the city of Chicago and were able to stand up the very first, isolation space. The considerations we had to keep in mind was the financial risk to the organization, because at the time when we started talking about this, there was no funding, right? The reputation risk, because of the fact that, if something were to happen because of this space, what would that do to our reputation? And, thirdly, the health risk, that wasn't third. It's not in any particular order. This is probably the first thing, is the health risk to our existing population and to our staff. And I'm really proud to say that while we know the landscape of the homeless organizations throughout the Chicagoland area has been very, very dire, there have been major outbreaks, major closures of homeless, organizations, including deaths. And, we're super grateful, thank God. Right now, we have only 2 reported cases among our 1,400 people throughout our system of COVID-19 positive. One is a veteran that, was at the VA, and we were notified 7 days later that he was COVID-19. He was in there for other health reasons. And then there was a person that lives in one of our supportive housing apartments who works at a nursing home. So it was something that she contracted outside of the organization, but she is within our system and is in one of our supportive housing units. And thankfully, she's actually isolating in place in her apartment. So we're bringing everything to her.
Neli, when you hear about all these cases in Chicago with the population, the homeless, and those most at need, those who most at risk, and you have a sustainable model that was able to respond because you do all the right things anyways. So, but I just want to say thank you for everything you do for the residents, the citizens of Chicago, for your staff who are on the front line, putting themselves at risk every day for the benefit of those that they serve. And to those who are listening, if you want to find out more about Neli and her organization, A Safe Haven, go to www.asafehaven.org. You can read up their newsletters, look at what they're doing. And Neli, thank you so much for being with us, being our first guest in the inaugural Midwest Matters. Thank you so much, Neli.
Can I say one more thing?
Sure.
Okay, I just want to say that in the midst of all of this craziness, I want to give a huge thank you to HUD. We actually closed on 2 veteran supportive housing programs. That one in Hobart, Indiana. So we're already starting to do the construction. We couldn't do a groundbreaking or anything because of COVID-19. But Hobart, Indiana is going to get their very first HUD VASH supported 75-unit project. And we also closed on the 90-unit supportive housing project in North Lawndale in Chicago, which is going to be right down the street, strategically located right between 2 VA hospitals and walking distance, a block and a half away from the Veteran Resource Center and from A Safe Haven. So I just cannot thank you all enough. That took us 2.5 years to get done. And we could not have done it without your support director and all the partners, at HUD who helped us, make sure that we got this across the finish line. It was very precarious because we know that everybody was closing down and we were worried that, this was going to get left on somebody's desk, and we made it right under the wires. So this was a big coup for all of us. So that construction has not stopped during this, shutdown. So those projects will be ongoing, and hopefully we'll be getting together in the spring of 2021 to celebrate the ribbon cutting together. So I look forward to that. Thank you.
And the work, it's tremendous work, and God blesses those who continue his work. So thank you once again, and let's pray for everybody here in the Midwest and the rest of our nation that we come out of this healthy. Thank you, Neli.
Amen. Thank you.
Organization, A Safe Haven, go to www.asafehaven.org. You can read up their newsletters, look at what they're doing. And Neli, thank you so much for being with us, being our first guest in the inaugural Midwest Matters. Thank you so much, Neli.
Can I say one more thing?
Sure.
Okay, I just want to say that in the midst of all of this craziness, I want to give a huge thank you to HUD. We actually closed on 2 veteran supportive housing programs. That one in Hobart, Indiana. So we're already starting to do the construction. We couldn't do a groundbreaking or anything because of COVID-19. But Hobart, Indiana is going to get their very first HUD VASH supported 75-unit project. And we also closed on the 90-unit supportive housing project in North Lawndale in Chicago, which is going to be right down the street, strategically located right between 2 VA hospitals and walking distance, a block and a half away from the Veteran Resource Center and from A Safe Haven. So I just cannot thank you all enough. That took us 2.5 years to get done. And we could not have done it without your support, Director, and all the partners, at HUD who helped us, make sure that we got this across the finish line. It was very precarious because we know that everybody was closing down, and we were worried that, this was going to get left on somebody's desk, and we made it right under the wire. So this was a big coup for all of us.